Hello everyone, hope you are all in good health. Welcome to the channel Chronic Kidney Q&A. On this channel, we will be discussing um, kidney failure in particular, dialysis, the process of kidney transplant, living with kidney failure and how that affects the patient's relationship with friends, family, um, loved ones, romantic relationships, and just everything surrounding them. I would encourage you to please look at the about section of the channel to have more of an idea of what the channel will be about. The format will be Q&A, so a question will be posed, and then an answer will also be um, proposed, and then there will be keywords, and then I will be expanding via audio on the response. Feel free to ask your questions in the comment section of any videos I post, or send questions to an email address which I have also in the about section. Now, I do need to make a disclaimer. I am not a medical professional in any way, shape, or form. If you have any concerns medically, you would need to reach out to your doctor or the medical team at the hospital. I I will be giving my opinion as someone that has lived with kidney disease for more than 10 years. So this is also based on facts and personal experience, if you will. I think this channel also will be beneficial in the sense that it will give people an opportunity to ask some of those questions that are not readily available, answers are not readily available online. So some of those things that you wouldn't necessarily hear from your doctor, but um, someone that has been through the experience would be able to assist. So I hope that would be, as time goes on, that would be the main focus of the channel. Of course, I'm just going to start with some basic definition of terms, also delve into specifics as I go along. But as I said, if you have any questions you want me to answer in particular, feel free to ask those. Now, I would say, because I want to really focus on everything about kidney failure, especially end-stage renal disease, um, I would please ask that we focus on that. Like, I wouldn't want questions about, maybe liver failure, cardiac failure, stuff like that. But of course, I can answer questions about life with chronic disease in general, and how it affects people around you. So I hope this brief introduction helps in stating the purpose of this channel. As I said, feel free to ask any questions if you need any clarification, and keep in mind that I am not a medical professional. So the first thing we'll be defining is kidney failure. And some of these definitions I just pulled some of them off online because I just want to, even if it may seem redundant, just provide some basic definition of terms to start off the channel before we start delving deeper. So kidney failure is when one or both of a person's kidneys does not function well. So this will require a formal diagnosis by a nephrologist. A nephrologist is a physician that specializes in the kidneys. So anything that has to do with the renal function of the body, the nephrologist specializes in that. So if your primary care doctor, for example, suspects that you may have kidney disease, he will pull in a nephrologist to examine you. Tests will be run, and one of the tests that will be run is to measure the creatinine levels. The creatinine is a chemical waste product that is produced by the muscles and is only removed by the kidneys. So if your levels are high, that is an indication that one or both of your kidneys are probably, not functioning at top capacity. Now, your diagnosis could be acute, which could be temporary or short term, and you could just have medication or some treatment that could reverse it. And stop any further degeneration, or it could be chronic, which is long term and worsens over time. Now, with that, it usually progresses into end stage renal disease. And when it's end stage renal disease, which is ESRD, at that point, dialysis will definitely be prescribed because your kidneys are not able to filter waste from your body. So dialysis would have to immediately take the place of that. So, for example, if you were in the hospital and you were immediately diagnosed with um, end-stage renal disease or some type of kidney malfunction and your levels are so high, um, they would immediately want to put in some type of catheter into you and start dialysis immediately. Like there are types of accesses that could be put in that you would have surgery the same day and start dialysis that same day. So the next thing we're going to be defining is the term dialysis. So dialysis is a treatment for people whose kidneys are failing to remove waste products, toxins, and excess fluid from the body. So with that, there are some things that your doctor will look at apart from the test results, checking the creatinine, checking things like your phosphorus, potassium. Some of these levels will be high off the charts. Um, so, and then excess fluid, you probably will have some type of edema, which is a swelling, especially in the foot. So some of those things will be looked at. Your coloring also, because when there is a buildup of waste in the body, um, it kind of darkens the hue of the skin, so to speak. So your color will be off. It wouldn't be like ruddy and look healthy. And once this is diagnosed, of course, I mentioned dialysis, to remove the toxins in the body that the kidneys no longer are removing. So dialysis, you could have hemodialysis and you could have peritoneal dialysis. Starting with hemodialysis could be, it's majorly in center, so you would have to go into the center, and this involves the circulating of blood to the dialysis machine to remove those toxins and excess fluids, and then the clean blood is put back into your body. While peritoneal dialysis, it has to do with dialysis using the peritoneum. So the peritoneum is the membrane surrounding the abdominal cavity. And then the dialysate fluid, which is used in peritoneal dialysis, will be fed into the peritoneum. And through a process of diffusion, the toxins will be drawn out into the fluid and then the fluid will be voided. Now, for hemodialysis, in center, you would usually go 3 days a week. So you would either go, most centers run on these programs, on these sheets. You would either go Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. The amount of time you run is determined by your nephrologist. So it's based on your body mass and how much weight, water weight you've gained, how much toxins needs to be removed from your body. So you would always have constant blood tests, like maybe once a week or once in 2 weeks, to gauge how well your dialysis is going, how well your blood is being cleaned. So, of course, I would encourage you to keep your appointment, because when you miss your appointment, the toxins don't get removed, and it doesn't bode well for your body. So for the hemodialysis, usually you would have some type of access. It could be a tunneled catheter, which they would put usually in the neck under the skin, and the catheter would be inserted in a major vein, so there would be blood access. So there are two outlets, one for the blood going out and then one for the clean blood going back in. So that type of catheter, they could put it in the hospital the same day, and then you could start dialysis on the same day. But those type of tunnel catheters are mostly temporary because of the risk of infection. So they would want to move it to a more permanent um, access, which is the fistula on the arm, and that would be connected to the veins on the arm, and then how it will be accessed is through dialysis needles. Also, some clinics offer the option of hemodialysis with the blood at home, but with that, you need to have a family member that is that will be trained to act as the nurse, so to speak, to administer that treatment to you for the hours that are prescribed. So some people could run for 3 hours, 3.5 hours, 4 hours, 4.5, 5 hours, depending on your size. But most hemodialysis patients go in center. As for the peritoneal dialysis, if you are a good match, this is something that you would have a catheter put into your abdomen, and you would have supplies brought to your home. You are personally responsible for carrying out your peritoneal dialysis. So you will be trained by the dialysis nurse. You would have orders brought to your house of the dialysis fluid and other medical supplies like the gauze, the cleaning materials, site cleaners, masks, anything, all the things, tape that you need to clean your site and to do your treatment. And then you will go in to see your nurse every month for blood draws and then to see the doctor. So with the peritoneal dialysis, this is done every night and doesn't involve blood. It's just the dialysis fluid. So overnight, you do it for however many hours. It could be 8 hours while you sleep. And then on the very last cycle, you leave some fluid in through the day. And through this fluid has is made up of pure water, electrolytes, some salts, and through diffusion, the toxins are removed from your body into the dialysis fluid and then voided out through the catheter. So that's the way that dialysis occurs. Since it occurs, you do it every night. It's gentler on the body than hemodialysis that involves blood, and then you have to do it 3 times a week and kind of have piled up toxins. Your diet is a bit less regulated with peritoneal dialysis. Um, Also, you can have more fluid on peritoneal dialysis than on hemodialysis. So I think for now, that's what I'll provide regarding dialysis. I'm sure as we go on, I may delve further into maybe what happens at the center during hemodialysis and some of the processes for peritoneal dialysis. Also for peritoneal dialysis, you do have a machine where you place the dialysate, warm the bag, do your connecting and disconnecting, and then the machine will be set with your prescription. The last thing I want to talk about is kidney transplant. So kidney transplant is an organ surgery performed to place a healthy kidney into a patient diagnosed with end-stage kidney disease. Now, with the transplant, only one kidney is transplanted into the patient. I don't think I've ever seen a case where two kidneys are transplanted. So I would think if it is a deceased donor that is deceased and they are an organ donor on their license, I would assume both kidneys will go to two different patients because you can survive on one kidney. Of course, if it's a living donor that comes forward, friend or family member that is a match, only one kidney will be removed and put into the patient. Now, for you to be eligible for kidney transplant, it is a very rigorous process and you have to be at the end stage of kidney disease. Your nephrologist at your dialysis center, your nephrologist will determine whether you are a good candidate for transplant in his or her opinion. So, like from your labs, you need to be relatively healthy, apart from, of course, the kidney failure, not have multiple organ failures, maybe pervasive or persistent infections, because the main idea is if or when you get a kidney transplant, they want you to have a good chance of having the kidney work and you surviving a good period of time. So they wouldn't want to waste, per se, a kidney on someone who may not make it through surgery or um, someone that the kidney wouldn't help, so to speak. So yes, the healthier you are, the healthier you will be able to tolerate the surgery. So that referral is important. You wouldn't just go to a hospital for kidney evaluation or kidney transplant without having a nephrologist going through that process with you. And then once you've been referred to a hospital that carries out the transplants and are an active member of the UNOS, which is the United Network for Organ Sharing, that is in the United States, there will be a rigorous, and when I say rigorous, I mean rigorous evaluation. First is medical evaluation, so from labs to cardiac evaluations, EKGs, maybe nuclear stress tests, lungs, like X-rays, if you're a lady, OBGYN, screening, just rigorous all around, just to make sure your whole health is checked and they have all that information. You also will speak with someone about your health insurance to make sure you have health insurance to cover the costs of surgery, because it is expensive, especially in the US. You will also speak with a social worker that would evaluate your mental well-being, whether you understand what you're about to embark on, whether you are able to follow instructions, take your medication and stuff like that. And the most importantly, you need to have caregivers for after the surgery is done. So they wouldn't want you to just go home, because you will be resting and bedridden for a while. They want you to rest without stressing yourself. For example, you can't lift more than 10 pounds for a while. So you need to have support before you are also approved. That's one of the things that needs to be taken care of before you are approved for a kidney transplant, to join the wait list, so to speak. Once you are approved, you could be denied, of course, for one reason or the other, but remaining positive, say you are approved, you will have a pre-transplant team of doctors, a coordinator that will be with you to make sure you keep meeting the requirements while you wait. So once you are approved, if you do not have a donor and you are waiting for a deceased donor, you will be made active on the UNOS list, which is the United Network for Organ Sharing, and you could be on that list for 3 years, 5 years, or even more, waiting for a transplant. So while you do that, you will be having evaluations periodically, at least once a year, to make sure um, your health is still okay, so to speak, to undergo the transplant. And you will be undergoing dialysis, of course, as this goes on. Once you are approved, if you do have a donor or someone comes forward during that time, you are able to secure a living donor. A date will be set for your surgery, and that will be that. Your surgery will take place. So that is the main information I want to give about transplant right now. Of course, there's a lot that I will delve in as time goes on. I just want to thank you for taking this time to listen to this. And as I said, if you have any questions, leave them in the comment section. Thank you for watching. Please don't forget to subscribe. Thank you for watching and listening. Don't forget to subscribe, and I will be back with you in my next video. Thank you.